regarding the motion to adopt. Supervisor Bielinski.
Yeah, thank you, Mr. Chair. I thought we were still on the timeline, and then I was waiting to ask, and I've had my hand up for a while, so I have several questions, and I do have actually a motion, I think, that I would like to put forward. So I'm going to be very, very careful. You know, sometimes, age of social media, we say things because it feels good to say them. I'm going to do my best not to say anything because it feels good to say it. I'm going to say the things I think need to be said here. So we are operating in a system, a healthcare system, that is sick. It is a cartel. It is evil. It is inefficient. And it's not something we should have to be operating under. We shouldn't have to be putting through this contract at gunpoint with this giant health insurance company to make sure that our employees can get health care. That's a frustrating position to be in. I've had lots of conversations with all county staff from a lot of different departments in these last 3 days, way more than I wanted to over the weekend, but it was very, very important that we had them. And I can say, from my perspective, I think that everyone here, you know, from the comptroller to the HR to the administration, is acting in good faith. And I think we need to put that out there because, you know, the words like scandal get thrown around, and I think people's character gets called into question, and, you know, it's unfortunate, right? I have policy disagreements with people in this room, but this is something that's above any policy disagreement. It's just something that's super important we get right. And so, real quick, my question is about the Willis Towers Watson contract. I had asked that they be here to address this, and they chose not to be here for whatever reason. When I hear the word broker, I think commission. I think they're taking a cut of the money that we could be paying for health care, and the service they're providing is skirting our RFP process. So, you know, we've had United Healthcare. They might be the best contractor out there from what is available to us, but I don't think we need to go through a broker anymore. We have the relationship. We've had it for many years with United Healthcare. We can probably negotiate it on our own with our own internal processes from here forward. So I would like to know what kind of financial incentives Willis Towers Watson has in these referrals they make, and in the RFP process they put out that magically only got 2 respondents. And so to that end, I would like to propose, and this is kind of where the committee comes in, either a by the committee amendment to this file, not the contract, to the file, or an amendment for board day to the file, which does 2 things. One, which makes it clear that the intent of this committee is to add our county's audit language and incorporate that into any future or current contract with United Healthcare in a renegotiation process, however that takes place under our process. The second thing is to reevaluate our relationship with any external broker for anything that should otherwise be RFP'd by the county. So those 2 things I would like to see included in either a by the committee, if it's the pleasure of the committee, or in a board day amendment. So that would make me feel more comfortable voting on this particular contract, which, let's be clear, the administrative piece is only about $2-3 million a year. But before I would feel comfortable voting yes, I would need to kind of put us in that direction. So what is the pleasure of the committee?
Supervisor Bielinski, I would say with respect to what you're requesting, it will not happen today. It should not happen today. We're not going to have a temporary layover for you to find out with whom from the research office could put that together and then wait for it to happen today. You also suggested it could happen on Thursday. So Thursday, I believe, would be the day, would be the time that it should happen as opposed to today. If you don't vote today, if you don't vote for it today, you don't vote.
Well, I'm not voting for it today.
Okay, well then,
but
we have that.
TBD after.
We have that information.
Thank you.
Okay.